The chief surgeon burst through the operating room doors, late, frustrated, and ready to scold anyone in his path. But the moment he entered, he froze. The monitors were stabilized. The bleeding had been controlled. The crisis had been reversed. And at the center of it all stood the quiet nurse he'd barely acknowledged for years, her gloves stained, her eyes focused, her hands steady, because in the minutes he was gone, she had saved a life all by herself. Before we begin, make sure to like, comment, share, and subscribe to Tales and Turns for more powerful stories like this. And tell us where you're watching from in the comments, your support means everything. The chief surgeon, Dr. Adrian Hale, was known throughout the hospital for his brilliance and his temper. His standards were legendary, his expectations even more so, and his patience nearly non-existent. So when he rushed through the sterile hallways that morning, 20 minutes behind schedule, he assumed the worst. A room full of nervous staff, a patient teetering on instability, and a nurse struggling to keep up, because in his mind, no one could handle things without him. But the moment he walked into the OR, something felt different. Silent. Controlled. Too controlled. He paused, eyes narrowing, wondering what he had missed. He scanned the room, expecting chaos. Instead, he saw precision. Every instrument was exactly where it needed to be. The anesthesiologist looked relieved. The surgical tech stood ready. And then he saw her, Nurse Liana Torres, standing at the head of the table, one hand stabilizing the patient's airway, the other adjusting the medication drip with the calm confidence of someone who had rehearsed this moment 1,000 times. She didn't notice him enter, she was too focused on the patient whose vitals were slowly returning to normal. For the first time in his career, Dr. Hale felt unnecessary. Moments earlier, before he arrived, the situation had been entirely different. The patient had crashed without warning, a sudden drop in blood pressure, oxygen saturation spiraling downward, alarms screaming through the OR. Panic had rippled through the team. Everyone looked toward the empty doorway where Dr. Hale should have been. But he wasn't there. And when no one stepped up, Liana did. She barked orders with a voice steady enough to cut through fear. She positioned the patient, initiated emergency protocols, directed the anesthesiologist, and clamped a bleeder she had noticed before anyone else. The team moved because she moved. They trusted her because she didn't hesitate. Dr. Hale finally found his voice and joined the operation, though hesitantly, almost cautiously, like he didn't want to disturb the balance she had created. He asked for a status update, but it wasn't the anesthesiologist or the residents who spoke, it was Liana. In clear, concise medical language, she explained exactly what had happened, what steps she had taken, and what still needed to be done. Dr. Hale listened in silence. And something inside him shifted. Because in her voice, he heard not just competence, but authority. The kind he had overlooked for far too long. As the surgery continued, Dr. Hale couldn't stop glancing at her. The way she anticipated complications before they arose. The way she guided the younger nurses without making them feel small. The way she caught a tiny irregularity on the monitor that he had completely missed when he first walked in. It unsettled him, not because she was better than he expected, but because she was better than he had ever allowed himself to see. And it forced him to confront an uncomfortable truth: his arrogance had blinded him to the brilliance standing right beside him every day. When the operation finally ended, the patient stable and safe, the OR team exhaled. Collectively. Relief washed through the room. Dr. Hale removed his gloves slowly, his mind racing. For years he had believed he alone carried the weight of responsibility, that the OR functioned only because he was in it. But today proved otherwise. Today, the OR had survived, and succeeded, without him. And it was because of one woman whose name he barely remembered during morning rounds, though she had been there for years. As the room cleared, Liana stayed behind to tidy the equipment, her shoulders relaxing for the first time since the crisis began. Dr. Hale approached her quietly, unsure how to speak the words he had never said to any nurse before. When she finally turned, surprised to see him still there, he didn't criticize or question. Instead, he simply said, "You saved him. You ran this room better than I did today." The shock in her eyes made him realize how rare it was for anyone to acknowledge her work. And the guilt hit him harder than he expected. From that day forward, everything changed. Dr. Hale began arriving earlier, not out of fear, but out of respect for the team that stood beside him. He listened more. he delegated with trust, not suspicion. And most importantly, he made sure that Liana's skill was recognized, not just with words, but with opportunities, authority, and the respect she had long deserved. The hospital staff noticed the change, the quieter operating rooms, the calmer mornings, the way Dr. Hale's sharp edges had softened. Months later, when the hospital board honored Liana with an award for extraordinary leadership in crisis, Dr. Hale was the first to stand, clapping louder than anyone in the room. Because he knew the truth, she hadn't just saved a patient that day. She had changed the way he saw his team, his role, and himself. She had reminded him that greatness doesn't always enter a room loudly. Sometimes, it stands quietly in scrubs, holding everything together when no one else can. And though he would never admit it out loud, that day changed his life forever.